And welcome everyone. Thank you for joining us this afternoon. My name is Meg Beyer. I'm part of the Managed Care Technical Assistance Center, or MCTAC team. And I am really thrilled to be joined by some of our state partners today to deliver this webinar to you. Today's topic is the updated guidance and readiness review process for the behavioral health carve-in to Medicaid Advantage Plus. We had some great information to walk through with you, but before we get to that and before our state partners take us through the content, just a couple reminders for the logistics today. So as you can already tell, today's webinar is being recorded. We are setting aside time at the end of the presentation today to answer questions. So what we're asking you to do, and my colleague Caitlin, who is the MCTAC admin, just graciously reminded us all, is to submit your questions using the chat box functionality. You'll see it on the right-hand side of your WebEx screen. And what we're asking you to do when you go to chat in your question, if you could select the drop-down and make sure that you select all panelists when you're chatting in your question. This way, all of our state partners who are on the line today can see the questions as they come in. Like I said, we have allocated time at the end of the presentation today to address your questions, but we encourage you to chat in your questions throughout the duration of the webinar. You don't have to wait to the end. If a question comes up for you, please don't hesitate to chat it in. We are keeping track of all the questions that are chatted in so that we can answer them at the end of the presentation, and also so that we are able to share all the questions that are received with our state partners on the line so they can review them after the webinar. So again, I want to thank you all for joining us today. And just a brief review of the agenda. Our state partners are going to walk us through the overview of the timeline and the guidance and the readiness materials. Then we'll take a quick review of the readiness review activities and timeline, and then we'll have Q&A at the end. So with that, I'm going to pass along the presenter capabilities to my colleague from the Office of Mental Health, Alyssa Altschul.
Thank you, Meg. Hello, everyone. Alyssa Altschul with the Division of Managed Care at OMH. I am the Director of the Bureau of Managed Care Oversight and Stakeholder Engagement, and I have not been on the last few webinars because I was on maternity leave, so welcome everybody, and I know many of you, but some of you are new to me, so it's nice to be here and to go over these documents with you that were released last week, and hopefully we'll have an opportunity to answer some very specific questions that you all have. So just to kind of recap where we're at, you know, our timeline is still that we are carving in the behavioral health services into the MAP benefit package on January 1st, 2022. So this would include the behavioral health outpatient services as well as the OASIS freestanding residential services. And we're going to talk about the very specific services on the next slide. And these services are really being included because we want to create a more comprehensive benefit package for MAP members. And we do believe that adding behavioral health will kind of make this a more well-rounded benefit package. And really the MAP product will be the premier product for members that are in need of long-term services and supports. So additionally, as folks are aging out of HARPS and mainstream, it allows them to receive the services through managed care that they were receiving previously. So it kind of creates a very smooth transition there when the member transitions to a MAP plan. So next slide. So you have seen this slide in other webinars that we've done on this topic. And this is just a list of the services that are carving in. So we have the core services here. These services are pending CMS approval. So at this time, you know, that timeline is kind of up in the air, but we will keep you posted. This includes community psychiatric supports and treatment, peer empowerment services, family support training, and psychosocial rehab. So those services, again, will be, you know, more information is coming out. And when we release guidance for plans specific to core services, we'll make sure to share that guidance with the MAP plans as well, because we don't really go into a lot of detail about these services in our guidance, given that they are not yet live. So On the mental health side, our list of outpatient services that are carving in for eligible enrollees. We have assertive community treatment, or ACT, continuing day treatment, CDT. We have CPEP, Comprehensive Psychiatric Emergency Program. And then we have partial hospitalization, personalized recovery-oriented services, or PROS. And then we have adult crisis intervention. So this is crisis intervention services available for enrollees that are over 21. And then I'm going to pass it to Tricia from OASIS to just go over the OASIS services that are carving in. Before I do, I will just say that we're not getting into a lot of detail in this presentation about what the services actually are, because we have done that in previous presentations, and you all should have more information in the reference materials that we have sent out in the past as kind of a guidance package. So if you have any specific questions about the services, let us know and we'll point you to the right place. Go ahead, Tricia.
Thanks, Alyssa. Yeah, so for the OASIS side of the universe, I'm going to go a little bit different than the slide, but more based on the continuum of care. So for your reference, the OASIS services that are going to be carving in are the medically supervised detox. So that's inpatient, that's our 816 services, as well as our inpatient rehab, which is part 818. Our ATCs, which are our part 818s, and some are also 820s, and these are all on the community side of the universe, as well as residential 820 services. And then on the outpatient side of the universe, we have our opioid treatment programs, which are carving in on both hospital and freestanding side. So these are also commonly referred to as methadone clinics.
All right, so we did, as I mentioned, send out some materials last week. And one of those documents was a guidance document for MCOs that are carving behavioral health into MAP plans. So this document basically kind of says you're going to be following everything that's in the request for qualifications for adult behavioral health benefit administration that we put out in 2014 or 2015, where we tell you that, or unless we tell you, that there are exceptions. And so this document really goes over the areas where there are exceptions, because we do understand that MAP plans, many of the MAP plans are smaller. And so we just want to be reasonable in our expectations around some of the main areas, specifically network and staffing. And then the care coordination requirements, we go into detail about, how exactly we want care to be coordinated for a member that is in a plan that also has an affiliated HARP or mainstream. And if not, how we're making sure that the plan really understands behavioral health and has the right expertise to deal with any requests that are coming in around behavioral health services and helping get members connected to behavioral health care. So next slide. So in the network section, we do differentiate our requirements for MAP plans that do or do not have an affiliated mainstream or HARP product line. And then we have, our contracting requirements, reimbursement requirements for in and out of network providers, and then the network standards. So you will see that depending on whether you have a large MAP or a small MAP or an affiliated mainstream HARP product line, the requirements will differ slightly. So we do encourage you to review that section and let us know if you have any questions. Next slide. So the document also outlines the staffing requirements. So when we carved behavioral health services into mainstream and created the HARP in 2015, we had quite a few, a higher bar and quite a few key positions and managerial positions that we required for those plan types. And so we say that you have to comply with the personnel requirements that are listed in the RFQ from that transition, but there are exceptions, again, because we are noting that some of the MAP plans are very small and it doesn't necessarily make sense for these plans to hire, you know, a bunch of staff when there are so few enrollees that would be accessing behavioral health services. So we describe at what thresholds the plans would then need to have those key staff. But regardless, we do want to make sure that as these benefits are moving in, that there are folks at the plan that do understand this population and that can be involved in training and authorizations and care coordination for those with serious mental illness, addictions, or co-occurring physical health challenges. So you'll see that outlined in the document. And next slide. And the care coordination, I mentioned briefly that, you know, we really want to make sure that there's integration for Medicare and Medicaid services, as well as physical health and behavioral health services. And so we are taking into account that some plans already have a team of people that work on behavioral health. And so we are really looking to leverage that. And we are asking for plans to be submitted so we can understand how that expertise is then going to be filtered to the MAP product line, and making sure that those folks are involved in the care management for members as they transition from one plan type to the next. And we also want to make sure that you know, that the plan is adopting and implementing clinical practice guidelines that are in line with our OMH guiding principles and OASIS requirements. So we just think that's important to call out, and there have been some changes since the RFQ was issued back a few years ago when we carved behavioral health into mainstream and HARP. So we say follow the guidance except for these areas, and in addition to that, there are some specific requirements for MAP plans. Next slide. So I'm going to turn it over to Laura to just talk a little bit about those thresholds that I was talking about earlier and what would be expected of the plans.
Great, thanks, Alyssa. Again, this is Laura Salso. I also work at OMH in the Division of Managed Care. So as Alyssa had mentioned, you know, the purpose of this slide is to outline network, staffing, and care coordination expectations based on MCO's previous BH experience and enrollment. And so the table identifies different MAP plan categories that the BH MAP requirements would apply to. So you have requirements that all MAP plans would have to follow, requirements for MAP plans with the affiliated mainstream HARP or HIV SNP product lines, and the requirements for MAP plans without those affiliated product lines. Then breaking out those requirements even further based on enrollment. So if we take a look at the first column, the MAP network requirements, all the MAP plans would be expected to follow the requirements listed in section 1A, however, which lists a bunch of, you know, different networking and contracting expectations in that document, which you can refer to. But if you are a MAP plan with greater than 1,000 enrollees, you would be expected to meet all those network and appointment standards for your counties served by 2023, with 50% of those standards being met by 2022. But if you're a MAP plan with less than 1,000 enrollees, you would be expected to monitor your enrollment and build your network to meet requirements within 6 months once you hit that 1,000 enrollee threshold. If you're a MAP only plan without the affiliated mainstream HARP or HIV SNP, you would also need to conduct provider training for BH providers that are new to your network. So then if you take a look at the staffing requirements, oh, I think someone needs to mute. There's just a little bit of feedback. So for the staffing requirements, the MAP plans with the affiliated mainstream HARP or HIV SNP must either attest they will utilize the same BHT and managerial staff from the mainstream or HARP HAVC SNP product line that Alyssa was kind of discussing earlier, or you can submit an alternative staffing plan. But I think, we think it's very important to be utilizing, the key staff just for that continuity. And if you are a MAP plan without the affiliated product lines and have greater than 4,000 or more enrollees meeting the HARP targeting criteria, you would be expected to have a BH medical director, a BH clinical director, and also the managers for behavioral health care management and utilization management functions at a 1 FTE dedicated to the MAP product line. So if you do have more than 4,000 of those enrollees meeting the HARP eligibility criteria, we really want to see those positions at a full-time FTE and that they're dedicated. So I think if you have less than those 4,000 enrollees, we are saying that we do want to see you can either meet those key staff expectations that I just went through, or you can submit an alternative staffing plan addressing the BHCM and UM requirements, what's listed in there, how your plan will meet that. And then for that last section, the BH care coordination requirements, those requirements are all applicable to all MAP plans. We don't differentiate between enrollment thresholds. Okay, next slide. I will be handing it off to Shenli at this point. Thank you.
Thank you, Laura. Hi, everyone. This is Shenli. I'm the Bureau Director of Finance and Data Analytics with OMH Managed Care. I will just go through the 2 monthly report briefly, and my state colleagues can chime in if I miss anything. So plans will be submitting the following 2 monthly reports to the Health Commerce System, aka HCS, which is also the site we use to collect all kinds of reports from mainstream, HARP, and HIV SNP. So the first report we're going to go through is the monthly claim staff report for behavioral health. This report will collect number of claims received, paid, and denied for each OMH and OASIS service. And this report is due the second Monday of every month, and the first due date will be February 14th, 2022, which will be reflecting the status of the claims plans received in the previous month, which is January 2022. And state will collect and review this report tentatively for 2 years unless otherwise instructed. The second report is the mobile crisis contracting report. This report will collect the contracting status of plans with each mobile crisis provider in plans catchment area at about monthly basis. And this report will be due 15th of each month or the following business day if the 15th is the weekend or holiday. Please note that the network adequacy of crisis service is not evaluated in provider network data system, aka PNDS, and is tracked separately via this report, which is Exhibit C only. But plans will need to submit the network monitoring report for all other OMH or OASIS services through PNDS, and we will be providing additional guidance for that reporting very shortly. And also, state will provide the templates for both reports ahead of time to make sure plans have adequate time to configure their system for those 2 data reporting requirements. All right, next page, please. Wonderful. So this is just a quick update on the billing end. We are actively working on the billing and coding menu for behavioral health Corp Inc. for MAP plans, which will be released very shortly. Following the release of the guidance, we will host a MAP billing 101 webinar for providers on September 21st, 2021. And of course, MAP plans can listen to this webinar, but they would ask plans to save their specific question via email to allow for the provider participation. So that will be the 2 slides I need to cover. I'm going to turn it over to my colleague Alyssa for next page.
Next slide. Thank you. So we have adjusted this timeline slide. You all have seen this slide before. I think, you know, the areas that are in red are really what's been changed since the last time we spoke. So as you guys know, we held the, we released some initial reference materials in April. We held our first technical assistance webinar, another technical assistance webinar specific to MAP plans in May. And then we released the guidance that we've been speaking about today last week on the 12th. We're holding the webinar today to go over those materials. And then we are planning on having a Billing 101 webinar on September 21st. I will just ask Laura quickly. I think that this date is reflective of a webinar that will be primarily targeted to providers. And I think that we are looking at having a separate webinar for plans so that plans can ask some of their more technical questions. But I just want to make sure that I'm right on that, Laura.
Yeah, this is Laura. I think we are thinking we would combine it and open it up to the MCOs. But I think I think we might need to confirm that. I think we were going to just have it as one, though.
Okay, so we will get back to folks on that. Regardless, there is a webinar that's happening on the 21st. Plans will be invited, but we just might be focusing our questions on the provider side on that webinar and having something separate for plans. We'll get back to you on that. So the next important date. So you guys know we distributed the readiness review tool, and that tool is what it outlines what plans actually need to do and submit to the state for review as part of the desk review process. And those materials are due back September 24th. So that's a very important date that plans would need to pay attention to and be preparing for now. I think that gives, was it 6 or 8 weeks for plans to get the materials together to submit. And then it gives the state another month to then review all of those materials and get feedback to the MAP plans. And so that's all happening this fall. We are going to be releasing a policy paper and amending MAP contracts to include the behavioral health services. We have TBD here. We don't have an exact date, but do know that that will obviously be happening sometime, you know, in the late fall, early winter. And we would also at some point be expecting that the staff would be hired, trained, ready to go for that January transition, but we've not yet set a firm date for that piece. You'll see here that there's a line for a virtual readiness review, and we do have an asterisk there. We have November 2021 listed, but we are still discussing, you know, what thresholds would necessitate that type of review. So we kind of need to see what we get from the first round of submissions from the desk review process to determine what exactly would be needed and when would a virtual readiness review be needed for the plans. So there are no dates that are set in stone as far as, like, you know, each plan having a date on the calendar to review, but we are working through what would be required, and we are going to work through that rather quickly so that we can get dates to you all if they're needed, but do know that might be happening in November. And I will just pause in case DOH wants to add anything there, and then I'll finish going through this.
This is Diane Kiernan from the Bureau of Managed Long-Term Care with OHIP, and I wouldn't add anything other than what Alyssa just shared. Thank you.
Thank you, Diane. So then we have for the December 2021 timeframe, this is when we would be issuing corrective action reports and then statement of agreements. So similar to other transitions for plans that have been with us for those carve-ins, we would be, you know, basically anything that we need the plan to take care of and make sure is in place before go live, we would be issuing in that CAP report. And then we would issue a statement of agreement that the plans would sign in return that would be committing the plans to making whatever changes are needed by whatever date we decide in that, based on what's reasonable, so that it goes smoothly when we implement on January 1st of the new year. So that is our timeline. There is also a note on here that just says that, we distributed the first round of FAQs to the plans on July 1st, and we are following up with a second round. Of course, we are here today to, answer any questions, but I realize that we are, we go till 1:30. So we're good on time. We have a half hour for questions. So hopefully we'll be able to get to those today, but do know that a formal FAQ will be following.
This is Laura. I'm just going to go through the readiness review process for MCOs that are unfamiliar, and just to give you a little background on the design and the process. The desk review tool for the BH MAP requirements was developed in collaboration with DOH, OMH, and OASAS, and we developed this tool to ensure plans were preparing themselves organizationally, programmatically, and systemically to administer the BH services that we're carving into the MAP. So the items in the desk review, while not comprehensive of all the requirements MAP plans are expected to meet as it relates to behavioral health, as we noted, there are some requirements too that are being carried over from the adult behavioral health RFQ. We did identify all the key pieces that the state wanted to make sure MAP plans had established prior to go live. Next slide. So as far as our key readiness priorities, we really want to make sure, and what we'll be looking for is to make sure that your staff have been hired and trained on the behavioral health requirements, that your systems have been configured to pay claims according to the behavioral health MAP billing guidance that is going to be distributed shortly, as Shen had mentioned earlier, that member services receive communication and education regarding these newly carved in services, and that member services staff are trained on how to field behavioral health questions on the benefits, referrals, and crisis response. It's very important the network is also established as required, and to ensure there is minimal disruption for members who are currently seeing providers at the start of the transition. So obviously the state is going to be monitoring your network, and we're going to be receiving network information from you guys to see that you're progressing on that prior to the transition. We also want to ensure that the locator is being used for the appropriate levels of care for members with substance use disorder. And finally, we want to make sure there is strong care coordination process in place, so members that have both Medicaid and Medicare needs are being addressed holistically from the BH perspective, as well as care coordination for members moving from a mainstream or HARP product line to an affiliated MAP plan. We really want to see that that's seamless for the member. So those are just really the key areas that we're going to be looking at. And then if you want to go to the next slide, this really just, talks more about the technical components of the desk review tool, which is that you guys, all the MAP plans should have received the Excel file, which outlines the BH MAP requirements and what the state wants to see from the plans as evidence. So whatever documentation or other materials the plan would submit to show that they have the policies and procedures or systems in place, et cetera. So the requests that are within that tool come from both the BH requirements document and the adult request for qualification. This tool will be used to report feedback to the plans once the state has an opportunity to review. And to expedite the process, please do not alter the template. We created it for a reason. And as long as we use the template, it will definitely help us to expedite the review. Another piece that will also help us to expedite the review is to make sure that when you complete, when you're submitting your documents, you are including the document file name within the document submitted column, as well as the page number that we can find the information to be located that's being used to demonstrate compliance with the requirement. And also, please try and highlight any areas within the P&P. If it's, it's a large document, make sure to highlight the specific component that we need to look at. For MAP plans with the affiliated mainstream or HARP or HIV SNP, as we've mentioned earlier, we know you've gone through, parts of this process for the behavioral health requirements. So some of the components within the desk review tool are pieces that you may have already addressed with us through previous reviews. And if that's the case, we do ask that you just note that in the document submitted column that, the previously approved PMP continues to remain in compliance. Unless you have updated the PMP, then you do need to submit to our review. So we just make sure that that continues to meet our expectations. I think that, and I do want to mention, we are currently in the process of establishing the Health Commerce System portal as a way for the MAP plans to submit their readiness materials. That is still underway, and there will be specific instructions on how to upload the materials when the September 24th date comes up. Okay, next slide. All right, and the final slide here is that along with the requirements document and as well as the readiness review, we also sent out the attestation, and the plans will be expected to complete that attestation by and return by December 1. That attestation kind of outlines, that you're attesting to meet all the components within the MAP BH guidance document that we sent, as well as other key areas such as staff training, configurations, provider training, and the attestation must be signed by the officer of the plan or general counsel as well as notarized. And we do provide an example of what an officer of the plan would be, example being a CEO, a COO, et cetera. And we do, we reserve the right to request any additional documentation that we need if we're not getting what we need, from other means. And finally, we are using this attestation as a component of the readiness review. So the plan, must ensure that everything is accurate. And if it's identified that something was falsely reported or incomplete, we can take regulatory action as necessary. And I think that is it for this slide. And I think we're into the Q&A. I'll hand it back to Meg.
Thank you. Thanks so much, Laura, and thank you to all of our state partners who just kind of walked us through this content. I just want to remind everyone, so now we're transitioning to the Q&A portion of our webinar, and thank you to everyone who chatted in your questions. We're going to start with those we've received, but I want to encourage anyone who might still have some questions to use this time to chat them in. And just as a gentle reminder, if you could chat them in to all panelists, that will enable all of our state partners who are on the line as panelists to be able to see the questions as they come in. So as we wait for some more questions to come in, I'm going to just dive in on what we've received so far. And I just want to qualify a few things, that if there's a question I read that our state partners aren't able to address on the line today, they will just let us know if they can't address it now, if they need to take it back. So just know that we have received all your questions. The state will receive them, and the state will do their best to answer the questions that we received today in the time we have. So first and foremost, someone is wondering, I think this is just a confirmation of language. So looking at, someone's question was, can you please confirm that the SAMHSA Act referenced in the behavioral health guidance for managed care organizations carving behavioral health into Medicaid Advantage Plus is referring to the assertive community treatment? I think they're just looking for confirmation around the language.
This is Alyssa Altschul. Yes, that's correct. So assertive community treatment or ACT, the OMH service is modeled off of SAMHSA ACT guidelines. So yes. Sorry that we did not spell out the acronym in that use of the term.
Perfect. We live in a world of acronyms, so anytime we can break that down, we're happy to do so. So thank you, Alyssa. Okay, so the next question, this is, let's see, around H codes. We have two questions around H codes. So will H9 individuals transition to the H7 when he or she becomes eligible for a MAP plan?
This is Alyssa again. So we are going to be issuing guidance around how to determine which enrollees are eligible for the core benefit because they have that HARP eligibility, as we call it. And we are exploring alternative ways to identify those folks rather than using the H7 code. So do be on the lookout for guidance that addresses that. I believe that this will be addressed in the billing guidance, but Shen can confirm. And if not, we will definitely be getting guidance out.
Alyssa, yes, we will be addressing that question in our core billing guidance. You probably won't see that in the MAP billing guidance because it's very likely we're going to issue the MAP billing guidance before the core billing guidance. But we will surely address that in one of the guidance we will be releasing very shortly.
Great. Thank you both Shen and Alyssa. Okay, next question. Okay, so someone has a question about the protocols that were referenced, I believe in slide 8. So they're wondering where the plans are able to access and find these protocols.
Sure, so this is Alyssa again. I believe that we have linked to the places where this guidance is housed, but if we haven't, we can make sure to include that in the next FAQ. But basically on the OMH website, there's an entire page on our managed care page that lists any specific policies or guidance for OMH specific services. And then we have the OMH guiding principles document as well. So we can make sure to include links to all of those places. And then OASIS, I will defer to you on where you guys house your locator information or any other relevant information.
Just checking, anyone from OASIS on the line able to confirm where exactly the locator or additional information could be found? Is it just the OASIS website? So we may have to get back to folks. It sounds like our OASIS colleagues might not be able to answer that at the moment, but we'll be sure to pass this question along and look for confirmation in a future FAQ. Okay. Jumping right ahead, just looking at the questions as they come in. All right, so here's the next one. Are plans required to implement prior authorizations for key carve-in services such as ACT and PROS on January 1st, 2022, or are plans required to delay prior authorization and reviews for a period of time? For example, 90 to 180 days after go live on January 1st, 2022.
Alyssa again. For this one, this is addressed in the guidance document that was sent out last week on the 12th. We are expecting that plans for the first 90 days after the services carve in, that the plan would not be conducting any utilization management reviews. So we wouldn't expect that you would be, having any kind of like clinical conversations or anything like that that would necessitate an authorization prior to January 1st. So we would expect that your systems would be able to accept and pay claims for services that are carving in for the first 90 days without any authorization required.
Okay, thank you, Alyssa. All right, next question. This one is about conditional approval. Plans are wondering, will plans receive conditional approval while DOH reviews the clinical or utilization management policies and procedures?
Hi, this is Ashley Filler with OMH. OMH will be reviewing the medical necessity criteria as it comes in with the readiness reviews. So we will be sending out conditional approvals. And if any plans have any questions related to the medical necessity review, webinar was held July 6th, which is available on the MCTAC website, and we can also post a link either in the FAQ document, and I can also post the link right in the chat.
Thank you, Ashley. Okay, next question, and just again, encouraging folks to chat in their questions as we continue to go through these. Let's see here. How will MAP plans be reimbursed by the state for these newly carved in benefits?
Hi, this is Shen. Our MAP billing guidance will provide additional detail regarding how MAP plan will be reimbursing those newly carved in services, including rate requirement and coding requirements. So that will come to the plan very shortly.
Got it. Thank you, Shen. And this is also kind of related to reimbursement, so this also might be addressed in the future billing guidance. Will the updated MAP fee schedules based on the new services to be carved in, will that also be included in the new billing guidance, Shen?
So for the fee schedule, I'm assuming folks are looking for the specific rate, right, for each, for example, procedure or rate code. OMH has a website where you can find all those most up-to-date fee schedule. Of course, our billing guidance will be referencing that website, but will not have the specific number because the rate, normally get updated, say, 1 or twice per year. So we will be providing, the billing guidance will have everything in one place, but it will give you the link where you can find the fee schedule for MAP as well.
Got it. So refer to the OMH website, and there will be, for the fee schedule, essentially, the billing guidance will have additional detail and information that will refer back to the OMH website. All right, so in terms of eligibility, how do plans know if they have enrollees that meet the HARP target criteria and risk factors that were referred to on slide 9?
So this is the other piece that's going to be addressed in the and thank you for correcting me earlier, Shen, in the core billing guidance. We are going to be giving specific instructions on how to determine eligibility, but I did see a similar question that was asking if it was an accurate assumption that not all MAP enrollees will be eligible for the core services. And I just want to confirm that that is an accurate assumption. We do not expect that all MAP enrollees would be eligible for core. And then in the core billing guidance that we will be distributing to the MAP plans as well as the HARPs, HIV, SNFs, and mainstream plans, we will give specific instructions for how plans can confirm core eligibility.
Great, thank you. And thank you for addressing that future question. I was going to go there next. That was great. Okay. Let's see here. What is the timeline for DOH to review the September 15th and September 24th submissions and then provide the plan's feedback? Is there any anticipated time frame the plans could be looking at?
Yep, so I think we had said early October in the slides, and so we don't have an exact date on the presentation, but we do expect to try to turn that around fairly quickly so that if there are any issues, it gives time for plans to address those issues. So we're going to do our best at the state. This is Alyssa from OMH, but we are working with DOH on the review of these materials, and so we're going to aim to turn that around pretty quickly.
Great. And just again about the two deadlines, someone is looking for clarification. So I think they're wondering if the mobile crisis network spreadsheet must be submitted on the 15th or the 24th when the rest of the readiness review documents are due. Looking for clarification around those two dates.
So in order to kind of get everybody on the same submission schedule that we already have in place for that document, we are going to say the 15th, I believe. And Shen, you can correct me if I'm wrong, but we do want to try to make sure that our submission dates are, are all lined up across different product lines. So. Shen, do you want to just confirm that?
Thanks. Sorry, Alyssa. It took me a while to unmute myself. Yes, I believe we, the BHO mailbox sent out the template, and I believe we previously said plans need to submit a template, the Exhibit C, on the 15th of September to align with the routine Exhibit C submissions.
So the 15th is
Right.
the date that folks should be concerned with. Is that what I'm hearing?
And this is Laura. I just want to mention too, because there's reports that we are collecting as part of just like the transition monitoring, which is like the claims, IT systems configuration work plan, and then the staff training. So that would also, I believe, align with the September 15th date for a shorter period. But then like, as far as the network and the other reporting, like the claims reporting, those would continue on post-transition. And feel free to correct me if I'm wrong, Alyssa or Shen.
That's also my understanding. Thanks, Laura.
Okay. Another question that came in is regarding monthly reporting, and when will that need to begin? Is it expected to begin with January of 2022?
That's correct. So for the claims that report, the first due day will be February 2022, which will be reflecting the data, the claims plans received in January 2022.
Thank you, Shen. Oh, that makes a lot of sense.
And then those,
go ahead.
Sorry, Meg, this is Laura. And for those transition reports too, that are requested from the desk review tool would start, you would submit those with the first desk review submission and then the 15th of the month thereafter.
Okay. Let's see here. Our plans, okay, so someone is asking about if the state could speak to member notices that are being offered.
Diane,
Sure
is that something that you're able to address, or are we going to provide information at another time?
Yes, we will get some information on that, and I apologize, we should have addressed it in the slide deck, so more details will be forthcoming on that.
Okay, more details to come. Okay, let's see here. So as a Medicare requirement, this plan they're required to send all existing members an annual notice of changes by September 30th. They're confirming that the core services should not be included in this document. And I'm not sure if we're able to speak to this on today's webinar. I'm just raising it as it came in as a question.
Yeah, this is Alyssa from OMH. I would assume, and DOH can jump in and we can certainly confirm, but I would assume that it would not be wise to include this set of services at this time, since we don't even have CMS approval on the services. And I know that there will be additional information coming out about announcing, any member materials related specifically to core at the time that we have an actual timeline for implementation once CMS has approved. So I would say probably not to include them. DOH can jump in and we can certainly look for like a more firm answer on that.
I would agree with what she just said, is to not include it at this time because we don't have formal approval yet from CMS, but we are working on that in parallel to this webinar today.
Okay. Okay. And then, so that was core, but then just more broadly, just are plans expected to include the carve-in details just outside of core? Are the carve-in details expected to be included in their annual notice of change?
Not sure what you mean specifically, but if it is the services that will be carved in, the answer would be yes.
Yeah, I think it was just a very similar question that was asked, Diane. Sorry. It's just that for annual communications, our plans expected to include carve-in details for current AEP materials. So if the state doesn't have an answer at this point, that's totally fine. I just wanted to make sure the questions were all being asked. Okay. Perhaps future guidance or future webinars will address that a little bit more. We're going to just keep moving ahead, looking at the time. When will plans receive updated carve-in language to include this for MAP member materials?
We are and we'll be working on that shortly and to get that out to you all as soon as possible. And I understand the time is ticking. Thank you.
Great. Okay. Okay. Someone is wondering if, let's see here. So someone is asking about information from previous webinars, today's webinar, if they maybe didn't join a previous webinar. I think MCTAC has worked with the state very closely on recording and pulling together materials. So we will loop back with our state partners and figure out a way to kind of share the recordings or slides that have been pulled together in the past for those who may have not been able to join from previous webinars. I know that's a question that's come up a couple times. Let's see here. Someone else is wondering, I think, if there are examples of alternate staffing models that can be shared on this webinar. I'm not sure if the state is able to speak to that.
This is Alyssa. At this time, I don't think that we have any examples because this is a new transition, and you know, I think we are really looking for the plans to give us to share with us their ideas, and if anybody wanted to have like a discussion or run something by us prior to the submission, I think we would be open to that within reason. You know, I know we're getting close and there's not a lot of time, but we're certainly willing to have those discussions if anyone would like to have them. You know, we're going to be reviewing them and looking at, you know, does this make sense? We're hoping plans have good ideas to share with us. But the main thing is really just making sure that the expertise is at the plan to manage the behavioral health benefits, and obviously where possible, leveraging the staff from other product lines where it makes sense to.
Thanks, Alyssa. All right, the last question we received is what, if any, are the claims testing requirements with providers and timeline?
This is Diane Kiernan from the Bureau of Managed Long-Term Care and OHIP. I would believe that that would be happening in November when we determine the readiness reviews one-on-one with the plans.
Okay. All right. So thank you, Diane. With that, I think those are all the questions that we've received. I'm wondering if there's any other, oh, go ahead, please.
I was just going to say, this is Alyssa, and we will just remind folks that when we sent out the documents last week, we did put down the OMH BHO mailbox, that's bho@omh.ny.gov, as a place to send questions. So if you didn't get your question answered today, or you think of another question after this webinar, that mailbox is available and we monitor it. And then we can look to include those questions in any future FAQs that we release.
Great. All right, well, I want to thank all of our state partners for joining, all of our partners on the line for asking the questions, my colleague Caitlin for helping to run the webinar today. And yeah, thank you for all of your questions, and we hope everyone has a wonderful rest of your day. Thanks so much.
Thank you.
Thank you.